Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
Hey, Tony here. I just wanted to tell you about a new forward that I put in the Unicorn Pharmacist Jobs book that I'd just written. And I wanted to speak directly to those who are place-bound or time-bound. So someone who's place-bound has to work in a certain place. Someone who's time-bound has certain hours that they need to work, whether around spouse, jobs, or kids, other responsibilities. Anyway, if you want to update your Kindles, it will appear for you, and hopefully that's helpful. So, without further ado, let's get on to this episode about burnout in health systems.
Hi, everyone. Thanks for joining us today. Again, my name is Christine Mason. I'm a PGY2 resident with the Ohio State University College of Pharmacy, and I'm here today with my friend and colleague, Shannon Kraus. So today is part 3 of a 4-part series where we're discussing administrative residency programs, our career paths, as well as some research that we're working on relating to burnout and workforce issues. So today in part 3, we're going to talk about burnout specifically in a health system pharmacy setting. So Shannon, can you tell us a little bit about why burnout is an important topic to look at?
Absolutely. Yes. So hello, everyone. Again, my name is Shannon Kraus. I'm second year Health System Pharmacy Administration resident at Ohio Health Riverside Methodist Hospital. And I am so fortunate that my master's research project that took over the span of my second year residency was focused on burnout. And so many of the listeners, maybe you've heard the term burnout, whether in national organizations or just locally within your place of work. And maybe you even heard it too much and potentially are burned out on the word burnout. But I hope that's not the case, because burnout has serious consequences. And so you may be familiar with some of the literature out there that links healthcare professional burnout to increased medical errors, healthcare-associated infection, and patient mortality. But not only is patient safety and outcomes a concern, but individual risk factors are so significant as well. You can think about overall just decreased worker satisfaction. There's ties, according to the National Academy of Medicine, noting that 400 U.S. physicians take their lives every year due to stress on the job. And so things as serious as this definitely is a call for action. But where we're potentially limited, or rather an opportunity that is ahead of us, is noting and uncovering what are those drivers within pharmacy, and specifically health system pharmacy. So Christine, whenever I did a PubMed literature search a couple months ago and I put the word pharmacy and burnout together, I yielded 74 results. But then when I did the same thing with physician and burnout, it was over 2,800 results. So clearly, as we both agree in our passion for burnout, definitely something that we can investigate a little further. And so there are a few studies out there within hospital pharmacy showing that emotional exhaustion, so out of the 3 dimensions of burnout, so there's emotional exhaustion, so feeling really worn out from your day at work, depersonalization, or that disconnect from patients, and then low personal accomplishment, so the triple threat of burnout. And so emotional exhaustion seems to be the main driver in both the physician and nursing literature, the plethora that's out there, and then in the few studies that are out there within pharmacy as well. And, fun fact for us, there is actually some resident literature out there that shows that, PGY2s, so our year, more hostile than PGY1 residents. So I don't know if you would agree, with about 3 months left to go in the program, but nonetheless, that's what the literature shows.
Yeah, thanks for sharing, Shannon. That's really interesting information. So when you think about burnout and you think about health system pharmacy and how we're kind of looking at all of this, what tools do you see that are available to measure this important topic?
Well, especially in the age of continued increased technology, there's tons of apps out there. Maybe not, some aren't as validated as others, but some that for researchers who might be looking for a academic intent. There's the Mayo Wellbeing Index out there that I know our medical residents at my practice site use. There's the Copenhagen Burnout Inventory, but really whenever you dive into the literature that is published, the Maslach Burnout Inventory is noted as the gold standard for measuring burnout. And so it really takes a deep dive into those 3 dimensions, that emotional exhaustion, depersonalization, and personal accomplishment pieces. And what is so great about the Maslach Burnout Inventory is that it can be catered to unique population. So for example, the MBI, or so Maslach Burnout Inventory, or MBI, for Health and Human Services can be tailored to medical personnel. There's ones that can be catered to teachers, or really just thinking about whatever audience you want to measure burnout in. There are some unique aspects that can make it more applicable to that audience.
Awesome. So we've talked a little bit about why burnout is important and kind of how we measure burnout and the tools that are out there. So tell us a little bit about the work that you're doing specifically in a health system pharmacy population.
Yeah, so very excited. One of the first studies to look at an entire pharmacy department. So looking at technicians and residents and interns to our pharmacists, looking at our administration. So overall picture of what the levels are and the drivers of burnout within the organization. And so my research team and I, we utilized, again, the Maslach Burnout Inventory and added in some demographic variables and some open-ended survey questions to look at the top 3 causes of stress, and then what strategies our associates wanted for Ohio Health to implement or push forward to help alleviate stress in their workday. And so my research team and I, we went to every hospital within our health system to tell a little bit more about the serious consequences of burnout, like I shared earlier today, and then shared with them the research that I'm doing and what we hope for them to do in terms of participating with the survey, and then the next steps from there. And so we generated a 40.5% response rate because of maybe those site visits, but then we're able to really engage and share the story of why burnout's important. And so of those who responded, overall, we saw that our pharmacy department, those that participated had moderate levels of emotional exhaustion and personal accomplishment, where ideally we would want personal accomplishment to be high because we want people to feel that they've achieved great things at the end of their day, and emotional exhaustion to be low because ideally we want our associates to feel invigorated. And we also saw low levels of depersonalization, which is the goal. We want our associates to feel as connected to their patients as possible. There wasn't anything significant difference-wise in terms of shift type, so no difference between third shift and first shift. There's no difference in number of hours worked per week, even though I thought maybe the residents who work maybe 80 hours or more might be a little more burned out, but that didn't seem to be the case. And no difference in years of service, which is really inspiring for our profession, that those that have been in the pharmacy business for 30 plus years are still engaged as those who are new practitioners. But where we did see differences was in that dimension of personal accomplishment, which is very unique because not too many other studies have called out a difference in this dimension of burnout before. And we saw that personal accomplishment was lower in females versus males. And we also saw that it was lowest in positions and regions, so our work locations. And so in terms of positions, we saw that personal accomplishment was very comparable between pharmacists, technicians, residents, interns, but it was lowest in those that were termed other. So that was our administrative assistants, as well as our informaticists, those that are supporting the business of pharmacy. And then in terms of region or work location, there really was no difference among all the hospitals that were surveyed, but where we saw the lowest level of personal accomplishment was within the administrative group, actually, versus the highest level was actually with the float. So those that got to float around to all the hospitals felt that they accomplished the most in their day. And so that's more, just the demographic influences, the Maslach Burnout Inventory itself. But again, I mentioned those survey responses, which were so helpful in helping us to identify what our people are telling us are to be their stressors. And so after going through the 800 plus responses and putting them into buckets based off of Maslach's guided domains of drivers of burnout, we saw that the top 3 causes of stress identified from our associates were related to the community, so coworkers, poor communication, control related to drug shortages, which many of us could probably relate to, and then workload. So too many meetings, too many emails, or just not having enough staff. But yeah, that's really, big picture of the great things that were found. So thank you to everyone who is listening and took that survey as well to help us uncover, some things that we can focus on as an organization.
Yeah, so it sounds like you guys learned a lot through this survey and you shared a lot of really interesting information. But I think something that really stuck out to me was the over 40% response rate. So for any of the students or current residents that are listening there, if you remember doing your journal clubs and looking at surveys, you you can see the response rate, and that kind of talks about, the volume of data, or, the percentage of folks that responded to the survey. So 40% is a really great response rate. So can you tell us a little bit about some of the strategies that you use to get such a high response rate?
Yeah, absolutely. Thanks for the recognition of that. We were very excited for that response rate. And so we had a 3-week survey collection window, so allowing some buffer time to also bring awareness to the survey itself. So it was sent out electronically via email with email reminders each week. And so having, a longer period as well as the reminders were helpful. But what I think was the most unique thing, which I mentioned a little bit, but also the most impactful, was those site visits. So making time during each team's huddle or team meeting that they had that week and sharing, it was 5 to 10 minutes, sharing the history of burnout, why it's important, why we're measuring this now, and what we hope to do with the results. And so by doing that, I think that generated a really great response rate. And with that, of course, that could potentially be a confounding factor because maybe those that participated were those that were most interested in the subject, and we might not have captured, those who were truly burned out. But nonetheless, still getting a good response rate through that raising awareness, and of course, loved being able to engage with the frontline staff across the entire health system.
Yeah, that's great. Thanks for sharing. So when you think about some of the data that you were able to collect and some of the things that you learned about the pharmacy team in the health system setting, what solutions do you have to implement to promote a culture of well-being?
Yeah, thank you again for asking that one. So I shared the stressors that were identified by those that took the survey. And again, this resonate with some other health system pharmacy teams as well, but I want to say, unique to our organization. But our associates also told us what strategies they wanted. So the answers are like many things. The frontline staff know what they want. So thankful for the strategies they proposed. And so they really fell into 2 main buckets. The first being staffing and workflow adjustments related to the workload stressor, the community stressor of coworkers. And so that would be having better training and more defined workflows. And then the second being a culture of well-being. And so some things that fell into this bucket, thinking about dedicated project time, having a calming space that they can go to during their breaks, having massage therapy, which would be awesome. Encouraging time off. So having our administrators actually encouraging their frontline staff to take the time off when they need it. And then, of course, more education on resilience tips. And so those were the 2 main areas that our survey respondents shared that they wanted to focus on. But I guess what a limitation was with these were all de-identified. And so while it would be great to have one fix that would fix, resilience and eliminate burnout across the health system, our research team recognized that each hospital across the organization has their own unique aspects that would drive stress. And so rather than just doing a one fix solution, we went back to every hospital again, shared the results with the teams again during the huddles or their team meetings, and asked them, based on these strategies that are proposed, what resonates the most with you at your location? And we took great diligent notes and shared that with the pharmacy leadership team across the system, and then encouraged those leaders to create a wellness action plan. And so they were able to individualize the solution to meet the needs of each campus, which was great. Instead of having that one fix solution, which literature also shows is not going to be fruitful, but instead individual, unique plans for each hospital there. And so that action plan is going to be tailored and refined over the next 30 days or so, and then hoping to reassess in 6 months. And so some of these action plan items include incorporating getting to know teammates during the daily huddles, shortening team meetings. So instead of a 60-minute meeting, cutting it down to 30 minutes to give people time back in their day. And then having comprehensive weekly emails that consolidate, what you need to know this week, rather than the endless email threads that can cause email fatigue. So excited that the leadership was so supportive and going forward with these action plans, and we'll continue to monitor and refine as maybe different stressors pop up.
Awesome. So thanks so much for sharing about, what you've learned and what you plan to do with this information that you've learned from your study. But when you kind of think back on the research process in general, for some of the students or residents out there that are wanting to get involved or are currently involved in research, what are some of the tips of the trade that you've learned through this project?
I would say first to look at previous residents' work. That's always a helpful starting point. So when you're thinking about posters or IRB submission or manuscripts, use some previous, if you are a resident, use some of that as examples of the template that you might want to use. So again, posters can be presented at national meetings, at local research fairs. You can submit manuscripts really anywhere that based on your research. So in the case of health system pharmacy, that might be the American Journal of Health System Pharmacy. You might present at ASHP, but definitely use the resources that you have. And if you're not in residency, of course, the published abstracts and posters and manuscripts are all there and publicly available for you to just have some sort of inspiration from. And then for those in residency or, interested in the poster and presentation aspects, take advantage of those local meetings that can give you a great starting point and building your confidence and presenting your research. Again, use your academic research teams. And so at Ohio Health, we're so lucky to have the Ohio Health Research Institute that helps guide us through the IRB process, writing our protocol, providing any support that we need for stats as well. So I know that's always a big fear. So don't fear stats. They're really not that bad. And you likely have a lot of resources within your program, or if not, think about the great pharmacy network that's out there that can help, with any fears that you might have with residency. But I don't know, I think the best tip, use the resources. They're very plentiful, and anyone is willing to help support you as you contribute to the pharmacy body of literature.
Great. Thanks so much for sharing, Shannon. This was a lot of good information kind of about what is burnout and why do we care, and then what you've learned through some of the research that you've done, and then some really great tips for students or residents or current practitioners that are looking to get involved in research. So with that, we have concluded part 3 of our 4-part series. So next time in part 4, we will talk about research about burnout in the community-based setting. So thanks so much for joining us. If you have any questions about administrative residency programs or want to learn more about Shannon and myself, you can go back and listen to part 1 or 2. And we look forward to having you join us in part 4.
Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom, and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes, and Amazon.com, in print, ebook, and audiobook. Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders.